Hello, my name is Dr. John DeWitt, and I am Professor of Medicine at Indiana University Medical Center in Indianapolis, Indiana. And I'd like to take this opportunity to discuss with you a paper of ours that has been accepted for publication into GIE. The paper is entitled Endoscopic Ultrasound-Guided Photodynamic Therapy for Locally Advanced Pancreatic Cancer. Pancreatic cancer is an almost uniformly lethal disease with a 5-year survival between 3 and 5%. There's been some exciting new chemotherapy agents and combinations that have been used for locally advanced and metastatic cancer, but clearly there's an improvement that needs to be made for treatment of these patients. Photodynamic therapy is a technique where a photosensitizer is given, and when exposed to a certain wavelength of light, the molecule is excited, and then when it loses energy, produces various reactions, including necrosis of the cells that took up the photosensitizer. EUS-guided PDT has been used in a healthy porcine model and appears to produce localized necrosis, and therefore appears to be ready for use in humans. In this phase 1 study, we took patients with newly diagnosed locally advanced pancreatic cancer that had not undergone previous treatment and considered them for EUS-guided PDT. These patients had an expected survival of several months and otherwise had no significant comorbidities, including hepatic, renal, and pulmonary or cardiac disease. After biopsy-confirmed cancer, the patients were offered enrollment into the trial. After EUS-guided PDT, 18 days later, the patient received a CT scan to assess for the degree of necrosis that was produced by the treatment, and then a few days later started chemotherapy using a combination of Abraxane, which is nab-paclitaxel, and gemcitabine. Patients were then followed by an oncologist with CT scans every 2 months until either the treatment was no longer effective or death or adverse events prompted a change in chemotherapy. EUS PDT was performed with a linear echoendoscope using a 19-gauge needle. The fiber had a 1 centimeter diffuser length and was placed into the cancer at 1 centimeter intervals apart from each other. The goal was to produce localized necrosis in the area of treatment. The study was a phase 1 study, and the goal of the treatment was safety. There were 4 cohorts. Each cohort had 3 patients, and there was variation in both the dose of porphyrin sodium that was used and the amount of light exposure that was given. The first 6 patients underwent or had treatment with 1 milligram per kilogram of porphyrin sodium, and the last 6 patients had 2 milligrams per kilogram. The first and third cohort had light exposure for up to 125 seconds per treatment, and the second and fourth cohort had up to 250 seconds of treatment. Since the study was a phase 1 study, the primary endpoint was safety. The secondary endpoints studied were the number of, or the amount of necrosis produced by the treatment, other adverse events, survival, and the number of patients that were able to undergo surgery following EUS-guided PDT and chemotherapy. For the study, we enrolled 12 patients. All 12 patients were able to complete therapy, and importantly, there were no serious adverse events from the porphyrin sodium, from the endoscopy, or the PDT treatment. The degree of necrosis produced increased in 6 of 12 patients, including 4 of the last 6, and ranged between 20 and 50% of the tumor. There were 2 patients who eventually underwent surgery. In one patient, there was a complete response. In the second patient, there was a residual 2 to 3 millimeter tumor. The mean survival in these patients was about 10 to 11 months, which was not significantly different between other studies. So the study showed that EUS-guided PDT is feasible. can be completed and done so without serious adverse events, which was the main endpoint of the study, and importantly can produce localized necrosis in tumors 2.5 weeks after treatment. This treatment stands in contrast to other PDT treatments which have been given percutaneously for both ampullary cancer and pancreatic cancer, and offers the ability to treat patients with one treatment as opposed to placing multiple percutaneous fibers that have been done in other studies. The safety and efficacy of this is significant enough that phase 2 studies are warranted. I thank you for your attention.